On December 1st, the world came together to celebrate International World AIDS Day, spreading love and support to those living with HIV. In Nairobi, the Health Secretary Susan Nahumicha led the charge, while in Kisumu, saw health partners unite for an impactful event honoring AIDS victims. Frederick Olwach, Director of Public Health in Kisumu, emphasized the day's significance, highlighting that living with HIV isn't a death sentence. Plus, it's a crucial opportunity to educate and reduce HIV infections. In Kisumu, HIV cases dropped significantly from over 12,000 to just 1,230 this past year. They credit this achievement to community involvement, breaking stigma and educating the public about HIV/AIDS. But there's more to be done, especially in educating youths aged 15 to 24. Kisumu alone contributes 10% to the national HIV youth population. The key, better education, empowerment, support, especially for young men, tackling issues like gender-based violence and teenage pregnancies.
The team from the press. My name is Frederick Olwach, Director Public and Sanitation, Kisumu County. Today is a great day, 1st of December every year. We celebrate World AIDS Day, and this is in commemoration of even the people living with HIV and even the steps and the strides we've made in terms of HIV response and even the care and treatment that we give. We have made some good progress, and for today we are talking about now empowering the community now to take charge and lead in terms of HIV response. As Kisumu County, it's a good progress for us. In the last 10 years, if you look at our data in 2013, we had over 12,000 people getting infected with HIV in 1 year. But now, currently, in 2023, that is 10 years later, we are happy to report that the number of people getting HIV, new HIV infection, has gone down, and in the last 1 year we've only had 1,730 cases. So if you compare that with over 12,600 cases in the last 10 years, then it is a good progress. And now what we are talking about is making sure that we let the community lead, we empower them, because we know that the new HIV infections, mostly we are seeing most of them in youths and adolescents from age 15 to 24. And in Kisumu County, we are still contributing almost 10% of this. I've talked about 1,230, but out of this, you realize that over 700 are from age 15 to 24. So that means we still need to do a lot in terms of HIV response to protect the youths and adolescents. Otherwise, that means the future of the people that we need to be productive in future to build the country might be in problem. So we also know that we want to end HIV in children by the year 2027, and this means it needs multidisciplinary approach or multisectoral, everybody, the community, ourselves, men, because most of these people, mothers, when they go to their hospitals for their first antenatal clinics, most of them are always tested negative, but then at some point you realize that they convert. So that means there's the role of men, and we cannot say that if men are not brought in here and targeted, then it means that the approach we are taking might not lead us anywhere. So we are also targeting men, the youths, and everybody. That's the whole community. And today we also want to appreciate the people from the community who have supported HIV response, both HIV and TB, to make sure that we have reached all these milestones that we are talking about today. Yeah, thank you very much. If we look at even the triple threat, we are looking at the teenage pregnancy, which in Kisumu is around 16.6. We are looking at sexual gender-based violence, which if we look at the current, what was given in health demographic survey that was released yesterday, that was disseminated yesterday in Kisumu, still at 11%, but also HIV infections, which we are talking of. So we are having a a technical working group, which is chaired by the county commissioner, to help us tackle triple threat. And that, if you look at teenage pregnancy, SGBV, and then HIV, all these are under what? Triple threat. So having government, both county and national, working with partners and even Minister of Gender to make sure that we track, we engage the youths, and we've already been going, having meetings with the youths in youth halls, engaging the youths through youth symposium. We had a conference, and even involving them in decision making. There are some of them are in the technical working group, and what we are getting from them, we listen to them, and some of the reasons why this happens make us really design our intervention, how we want to handle this. We working with the Ministry of Youth, Department of Social Services, and the Ministry of Youth and Education. We are making sure that already we have designed and even education programs that we are going to target the youth and adolescents, even in schools, to engage them, educate them, and empower them to make some positive decisions about their lives, and even support us in response to HIV/AIDS.
You are watching Media One International, always fast and fast. Like, share, and subscribe.